Dr. Abi Kuku.
Hello, everyone, and you're very welcome to yet another episode of Clean Health. My name is Dr. Obi Kuku, a consultant cardiologist and a fellow of the West African College of Physicians. With me here in the studio is a special guest in the personnel,
Farouk Nanopelu, a journalist, development practitioner, and a public analyst who is also very much interested in health communication. It's good to be a part of this show once again.
Oh, thank you so much, Mr. Nana Bello. In the previous episode, we looked at an overview of hypertension, who is affected, the types of hypertension, and the risk factors for hypertension. Today, we'll be looking at the signs or the symptoms, as well as the complications of hypertension. Stay tuned with us as we come right back. But again, don't forget to click the like button, lay your comments in the comment section, share these videos, and please do subscribe. Thanks for watching. We'll be right back.
Clean health. Healthy living, illness prevention, and health awareness with Dr. Abi
Welcome back.
Kuku.
Mr. Nana Bello, over to you.
Yes, so you're also giving me the same honor, you know.
Sure.
I remember the last time you said I should guide the discussion.
Yeah,
Well, that's good. It's good to be a part of this show once again, like I said.
same here.
You know, in the previous discussion, we actually talked about what this hypertension is all about.
Yes.
People who are, of course, prone to getting hypertension,
Yeah.
as well as the risk factors.
Yes.
I am happy that we'll be looking at another aspect of this issue, which is important.
Yeah.
You are the expert here, as always. So I will start with, of course, the focus of the discussion today will be on, symptoms and complications.
Yeah.
So let's go with the symptoms.
Yeah.
What are the symptoms associated with hypertension?
Beautiful question. The symptoms of hypertension largely, we don't have symptoms usually.
Okay.
It's largely asymptomatic. So you see a patient or people walking around normally without any complaints.
I remember you referred to it as
Yes.
a silent killer.
Yes. So their blood pressures are high. You go to the marketplace, people are walking around, running, selling, their stuff, traveling up and down, trying to make ends meet. They don't do blood pressure checks, and
Yeah.
the blood pressures are high. But it does not show any symptom, okay?
Yeah.
In a whole lot of cases. But in some cases, and that's why it's referred to as a silent killer.
Silent killer.
Yes. Slowly it will be destroying organs till one day they manifest with complications, affecting either the kidneys, the heart, or the blood vessels.
And that's why some people come down with stroke?
Yes, so stroke. And then some people will come down with other complications, which we'll talk more about, okay?
Yeah.
Yeah. So, but in other cases, they could have headaches,
Okay.
Frontal or what we call occipital headache. Occiput is the back of the head.
Okay.
They could have severe headaches that are throbbing in nature. They could
Okay.
have buzzing in the ears or ringing sensation in the ears. They could have problems with vision, blood vision, or difficulty in seeing. Sometimes sudden blindness. Okay? Yeah. Sudden blindness.
It's indeed a very
Yeah,
complicated
sometimes,
problem.
they could have weakness, generalized body weakness, feeling of fatigue, sometimes heaviness in their head. Those are just non-specific symptoms. If it's so severe, the blood pressure is so severe, they could come down with even convulsions.
Wow.
Yes, convulsions. They could come down with coma. They could become unconscious. And then sometimes they'll be rushed to the emergency. So
Now
these are-
you talked about general weakness of the body.
Yeah.
I don't know. You need to talk more about this general weakness of the body. Is it when I feel that my joints are weak, or something like
A
that?
lot of things can cause weakness of the body for a lot
yeah,
of
so-
things, but it's just a non-specific symptom. It's not
Okay.
compulsory as a result of hypertension.
Oh, okay.
But these sometimes, individuals differ. So in
Okay.
some people, they just feel they're weak, they have headaches, they're not so strong because, of course, the blood vessels are hardened, they're narrowed. So blood supply to the tissues is reduced. And so then the tissues need oxygen and nutrients. If you're not supplying the tissues, of course, they'll be crying for food.
Okay.
They'll be hungry, isn't it?
Yeah.
Sometimes they'll have low energy.
So by implication, if you have any of these then it is a cause of concern.
Yeah, sometimes nosebleeds.
Okay.
People having nosebleeds and so on. So it's a cause of concern. You should present to
Does this
doctor.
happen at the early stage, or when it's like after a long period of time? Maybe because we said it's a silent killer, people have these problems without knowing.
Yeah.
Now, does it take longer period before you begin to experience some of these symptoms, or even at the early stage of
Yes,
getting
usually,
hypertension?
usually people are hypertensive for a long time, they don't know.
Okay.
But the disease will be slowly destroying the organs in the body and causing a problem.
And begin to manifest.
Yes, to begin to manifest. So sometimes over 10 years, by then they begin to have some complications.
Okay.
And some of the complications include, it can affect any organ in the body, right from the brain to the heart to the kidneys, to the blood vessels, even to the male sexual organs or the organs of the females.
Is it one way or okay? You just okay.
It's both ways.
All right, you actually responded to
with
that.
the brain, yeah, they could have stroke, difficulty moving one half of the body or one half of the face, a sudden onset, okay? In fact, you've heard of patients say, I woke up early in the morning trying to do some ablution or maybe go to ease myself in the toilet and I suddenly fell to one side of the body.
Yeah.
And sometimes they could lapse into unconsciousness. They don't know, they're not aware of their environment. In other cases, they come down with convulsions and then difficulty in speaking, okay? Lack of being unable to talk. Okay? So that's a form of stroke. Okay? It can cause memory loss.
Wow.
Yes, it can cause memory loss. In the heart, it can cause heart failure. Okay? What do I mean by heart failure?
Okay.
Their heart is not able to pump blood adequately.
Which is very necessary for survival.
Yeah, to all the organs of the body. And so they have difficulty in fusing all the organs of the body.
Now talking about heart lacking blood, which of course brings more problems. Let's quickly slide into the complications associated with hypertension.
Yeah, that's what we're talking about.
Yeah, okay.
It's in the heart.
Okay.
I've talked about the brain.
Okay.
And the heart now. You have heart failure.
Okay.
Well, the heart cannot pump blood adequately to supply to the tissues in the body.
Okay. Yeah.
So they can have symptoms of breathlessness. They tell you that they're breathless. They need to use 2 pillows to sleep because if they lie down flat, they wake up breathless.
So how do you use 2 pillows to sleep?
Yes.
Since we have to sleep on one side.
Yes, now because they're breathless, they're looking for oxygen.
So using 2 pillows is one kind of a solution.
When they use 2 pillows, yes, it has to lift them up so that they don't feel breathless. Okay? They feel
is
more
this
relieved.
medically?
No, that's what the patient complains of.
Oh, okay.
That they're breathless, that they notice that they're breathless. If they walk a distance, they have to stop for breath. If they climb the staircase, they have to stop because of breathlessness.
Okay.
And even it's progressive and it's worsening over some weeks to the point that they notice even when they lie down, they cannot lie down flat. If they lie down flat, there is a venous pump mechanism that pushes blood back to the heart. So there will be congestion within the heart. Within the heart, there will be congestion within the lungs, okay? And then with the congestion within the lungs, they have to cough out, isn't it? The fluid is not supposed to be in the lungs. So they find that they're coughing and breathless. It can cause night coughs, okay? It can also cause leg swelling,
Okay.
in heart failure. Yes, yeah, you see them with their legs swelling. They were like, someone did it from the village.
Meanwhile,
some native, Africans, they believe in.
So talking about somebody has done it from the village, it means that there is a cultural angle to all of this problem.
Of course, Nigerian Africans, we so much believe in native medicine and so on, witchcraft and all that.
Yeah.
I'm not saying it doesn't exist anyway, but they attribute certain things instead of being really in tandem with reality. Look, you should have been checking your blood pressure. You should have been checking your health regularly.
Yeah.
All right. Then when they now have complications, they're now attributed to some powers from the father's house or some witchcraft powers pursuing them. Okay. All right. So with that, it's important that we do regular checks, blood pressure.
Yeah,
checks.
because I was actually going to talk about that regular checks up. Because another concern I have is that while these are the symptoms, some people would rather wait and see if it will persist. Before they will look for.
And then some of the Africans, they go around. Okay, they go around different native doctors. Okay, they go around different maybe all these local doctors now are not qualified. I don't say they are doctors.
Yes.
There are people that are not qualified. before they finally come to see a specialist.
The situation would have,
the
gotten
situation would have
complicated.
gotten worse. Other things in the heart can cause heart attack. Have you heard of heart attack?
Yes, very well, because it has killed a lot of people.
Yes, it's more common in the Western world. But now it's coming up in Nigeria.
There's this, I don't know, I think there's a need for you to talk about this a little bit. There's this general belief that as Africans that we are immune to a lot of problems, including this hypertension. Maybe you should draw their attention to it.
That we're immune to hypertension?
You're like immune to a lot of problems, that we are very strong people, and so we can, fight it off.
Oh, really? Not really, not true, not true. Right now, because of the adoption of Western lifestyle, we're seeing a high incidence or high prevalence of these cases in Nigeria and Africa. It's becoming so rampant, even worse than in the Western countries. And people are not aware, okay?
Yeah.
And even those that even have been found to be diagnosed, just 1/3 people are diagnosed.
Yeah.
Only 2/3 are on treatments, okay? And most of them are not regularly taking the medication.
I'm afraid that's the much we can take, maybe.
Well, there are other complications before you stop.
Okay.
We also talk about the kidneys. They can have kidney failure.
Okay.
So they could complain of foaminess of the urine.
Okay.
And then reduced urine output, and then facial swelling,
Okay.
and then subsequently leg swelling.
Okay.
So they tell you maybe they went to the village and they crossed something,
Mm.
and they noticed their leg was swelling.
Yeah.
But ab initio, when those problems of maybe foaminess or some change in their urine, they noticed, or some facial swelling,
They
ignore them till it got to that stage. Okay. It can also affect the erection.
But most importantly, quickly,
Yes.
is this something that can be reversed?
Yes.
Maybe at early stage, like reversed completely?
Early stage.
Yes.
Early stage before complications set in.
Okay.
Yes, we can prevent it from progressing to the complications if the patients are taking their drugs regularly. Okay?
Okay.
We can prevent those complications. So if you're hypertensive, you take your medications because you have to take it for life. You have to take your drugs for life. Take it religiously. They're doing that, you will not have complications. When you have complications, we can still manage those complications. Okay? We can still manage those complications.
Okay, maybe in the subsequent edition of this program, we'll be looking at how to manage these complications. I am sure you have a lot of advice to give to the viewers out there on, how to treat this and how to manage it.
Yeah.
Well,
so this brings us.
I'll now hand it back to you.
This brings us to the end of this episode. Do click on the like button, leave comments in the comment section, subscribe to this video, and share our videos so that more people can be aware, and then will prevent complications. Thank you, Mr. Nanabello.
It's a pleasure, as always.
Thank you all for watching. We'll see you in the subsequent episode.
Clean health, healthy living, illness prevention, and health awareness with Dr. Obi Kuku.